good morning. Who knows? It is Wednesday the 8th of January. If you're new to my channel, my name is Karen, or Kaza, and I have unfortunately started a breast cancer journey. And if you want to come along on the ride, hit that subscribe button, give me a like, and come along. Yeah, I feel a bit, I'm going to see the surgeon. I was supposed to be meeting my friend, and we were going to go for breakfast and then go to the appointment, because the appointment was originally at 1:30. However, they rang me yesterday and said, is there any way you can come in at 9 o'clock? And I was a bit like, oh yeah, okay. 9 o'clock's early for me, in the sense is that my mother's got dementia. She was still in bed, so I had to wake her up and sort her out early. But she's fine, I've sorted her out. Again, if you're new to my channel, I'm also looking after my mother who's got dementia. She's not full-blown dementia, but she's hard work dementia. So yeah, so that's adding to my, my nightmare. Yeah, I'm going to see the surgeon who's gonna get me to sign my life away with all my consent forms. So if anything goes wrong, I've signed it to say yeah. I think they're telling me about the operation, and I did say to one of the cancer nurses who rang me, have I got to have a wire fitted? And I think I have. It's a guide wire. So they fit you with this wire under local anaesthetic. Nice. And then when you go in for surgery then the next day, they know where to go. But as far as I'm concerned, take the boob off. Who needs it? Don't need it anymore. I'm not body beautiful where I'm like, oh my god, I need my boob. And people that I know have told me that people they know refuse to have their boobs off, or they refuse to have chemo, and they're no longer here. I'd like to be here a little bit longer, considering I'm 50. And yeah, but it's a bit like, well, if you take it off, it won't come back. But they know best, so I'll see what they say today. And yeah, I've got to have radiotherapy. I don't know if I've got to have chemo yet until they, I think, test what comes out. So, if I've got to have it, I've got to have it. If I lose my hair, lose my hair. I'm just doing whatever they say I need to do to get right. Right. I shall see you in a bit, guys. Obviously I can't take you into the room and all that jargon, but I'll let you know what's going on as I know. So I've just seen the surgeon. I'm waiting to see a nurse. So I am now in the consultation room. Got a lovely mural on the wall in front of me, all mirrored along there, to tell me more about the operation. I've just signed my life away, signed the consent forms. She told me what she's going to do. And I'm keeping my boob. They're not taking it off. They're doing the lumpectomy and a week of radiotherapy. And then they're going to get back to me whether I've got to have chemo or not. But she said the radiation is just as good as having your boob off. And because I'm dodgy on my feet, because of my knees. She said having my boob off and then being left with one might not help with regards to my mobility. So best I keep it for now. But yeah, I'll let you know more when I know more. Right guys, I'm out. I'm just following my friend and we're going for breakfast. What time is it? 10:20. They're really nice in that place. They can't be any nicer to you, which is nice. Yeah, so it's all systems go now. So tomorrow I've got to go in and have a wire fitted, a guide wire. It's actually amazing what they do, because I've got to have a nipple. I've got to have an injection behind my nipple, which I've got to be honest, I'm not enthralled at having, because apparently it can be quite painful. But they're going to give me radiation. I can't remember the words, but they're basically going to inject me with radium. Is it? I'm going to be radioactive. But it's quite safe apparently. And this is they do it behind the nipple and it travels up to your lymph nodes. And when I have my operation then on Friday, they listen, they have an instrument or something, and they listen for the radio waves, and they know then which lymph nodes to take out. It's quite amazing really what's going on here. Something going on in my car. Radio that came on. Yeah, it's quite amazing what they do. But they did say if they can't hear the frequencies and they don't get as good a result as they want from that injection, they will then, while I'm asleep, put dye in me, which will then show up the ones. And then she said the side effects are, for 24 hours, if I cry, which I probably will, my tears will be blue. My wee will be blue. She said you can look grey, you can get a blue boob, which lasts for a few weeks. There's quite a few side effects. You can also have an anaphylactic shock from this injection, but she said the best place to have it is while you're under anaesthetic. What else was she saying to me? It goes in one ear and out the other. But I've got literature with me, I've got my appointment with me. When I'm back in the house, I'll let you know. I've got to do exercises with my arm. I've got to also cream my arm and push up, not down, to push the fluid down, up, back to my heart. I've got to be referred to the lymphedema clinic. I've got, I've got loads of stuff I've got to do. Right, where are we going to park here now? Right, I'll be back with you because I need to park. Guys, I've got parked and I'm going in. It's a place called Foodology. It's a new place my friends told me about. So we're going to go in and we're going to have some breakfast, and we're going to have a naughty breakfast, I think, because that's what things are called for on days like this. But yeah, I shall update you more. I've got to nip to the shop and get a couple of things. I need to get some paracetamols and stuff. But yeah, it's all steam ahead now. Not long to go. I'm back quite a few hours later. It is now 1:30 the next day. And it's a crazy time. It's a crazy time. I'm super busy. I'm super busy eating. I need to sew my mouth up. And talking of eating, that breakfast, me and my friend went and had breakfast. It was a place called Foodology. If you're from like the llantrisant area and you've never been, you've got to go. It is by the hospital, Royal Morgan Hospital. If you're from the area, you go up to the big roundabout where the Caterpillar plant is, where they make the Caterpillar machines. You go around the roundabout, first left, and it's behind there. My God, it was absolutely bloody delicious. It was so nice. I said to Warren, I said, oh, should we go there today? Because Warren's off today and tomorrow. And the reason he's off is because I said to him I might not be able to drive home after my appointment now today, because it's now the next day. So he's off. So I was like, oh, should we go for breakfast? Because actually tonight, it's 2 o'clock officially, but I'm going to do it from midnight. I'm not allowed to eat or drink anything. I'm allowed to drink water up until 2 hours before the operation. But you know me, if you watch me regularly, I friggin' hate water. The only thing I do with water is washing the friggin' stuff. And I'd rather die than drink water. Yes, I did say that. I freaking hate it. And my mother always says to me, oh, you stupid girl. It doesn't taste of anything. Don't be so stupid. Just drink it. I don't know what it is. It's disgusting. So I have actually bought one of them little squeezy orange squashes to put in my hospital bag to take in, because I thought when I come round, I'm going to be wanting a drink. And I thought I can't even drink hospital water. So, but on one of the letters I've got, I'll read it out to you. It tells you can't even chew chewing gum. If you chew chewing gum and you tell them you've chewed chewing gum, they won't do your operation. So I'm going to be thirsty as hell. Anyway, let's talk about the next procedure. If you're squeamish, you might not want to listen. So trigger warning. Right. So today I went to see the surgeon. I'm under a surgeon called Miss, I think, is she Miss? Yeah, Ms. Long. Is my consultant, but she's the surgeon. She's lovely. She's really, really sweet and really calming and really quiet and not like me. But she's lovely. And that's one thing. Every single nurse I've come across is absolutely lovely. Right. The reason I'm looking down is because I'm looking at letters. So, this says Friday the 10th of January. I've got to be on the ward for 7 o'clock in the morning. Warren can't come with me. He can only drop me at the door. Not that I want him there, but it's a bit like, drop me at the door and ta-da. That could be it, you know. See ya. Nice knowing you. But yeah, he's dropping me there. It says, please bring all tablets and medication with you. And it says you are also required, they need to get somebody who can tell what day it is, because this could confuse someone who's not quite with it. It says you are also required to attend the Snowdrop Centre on Thursday the 10th of January. Well, it's not Thursday 10th of January, it's Thursday 9th of January. So if somebody wasn't really thinking straight because they were concerned and stuff, they'd read that as 10th of January and go Friday, and then they'd miss their op, wouldn't they? Anyway, today now, the 9th of January, I have to go at 3:45 to have a wire inserted for surgery. It is a guide wire, basically. It says, please make sure you attend this appointment so that your surgery can go ahead. You are then required to attend the radiology department in the main Royal Glamorgan Hospital, which is across the road, on Thursday at 2:30 for your isotape injection. Please make sure you attend so your surgery can go ahead. It will be necessary for you to restrict food. God damn it, restrict food. Don't do that to me. And drink before surgery as indicated on the attached sheet. This is for safety to reduce the risk of complications. It says, if you have been advised to stop any medication by pre-assessment department, please follow instructions for or your surgery will be cancelled. So, I need to I'm on a tablet called Ramipril, which is for blood pressure, which I was put on when I had Mackenzie, because I had normal blood pressure when I had my kid. Well, when I had Mackenzie, and then it shot up through the roof, and it's never come down. So my blood pressure's high. So I'm on Ramipril, and they've said on the morning of the operation to take my tablets as normal, but not to take Ramipril. So I've got to make sure I don't take Ramipril. That's it. I've been drinking here. Yes, I can't take Ramipril. So, this is my pre-operative fasting? What the fuck? And anaesthetic guidelines. Fasting, come on, dear patient. Before surgical operations, there are restrictions regarding eating and drinking, which are essential for your safety. These apply whether your operation is under local or general anaesthetic. Oh. That's just made me think. Well, I've got till... Oh, hang on. I'm having local anaesthetic to have this wire put in. Oh, maybe I better not go for breakfast then. No, that can't be right, because I didn't have to restrict my food when I had my biopsies, and that was under local. To receive any anaesthetic, it is important for your stomach to be empty. My stomach's never empty, man. It's always full to the brim. You can eat normally up until 6 hours before your operation. Better not go for breakfast then. Damn it. It says, for example, 2 a.m. for a morning operation or 7 a.m. for an afternoon operation. I better not eat anything after 7 o'clock then. Yeah, 1:45. Oh, like I read that. I don't think it actually means my operation today, but I'm going to do it just in case, because I don't want them to say, oh, you filled your belly now, you can't have your operation, because if I can't have the wire put in today, then I can't have the main operation on Friday. And I'm thirsty as hell, so I'm going to... There's hardly any drink left in here. Right, that's breakfast out of the way. What's it say here now? Yeah, because it says failure to keep these guidelines will result in postponement of your operation for your own safety. And I can't have it postponed, so... Right, I've answered my own question. Special notes. Medication. It's important that you take any normal medication with sips of water at normal times, unless instructed otherwise. Ah, that's going to kill me. Take my medication with water. How am I going to do that now? That's going to be a killer, that. Do you know what? I'm not allowed to take my Ramapril. I think I'll just skip my other ones. There's no way I'm going to be able to take my tablets of water. Yes, I know I'm a grown adult, but yeah. Chewing gum and sweets are regarded as food, therefore must be avoided for 6 hours prior to surgery. Jewellery, please remove all jewellery. So I'm going to have to take out my nose ring. I forgot to ask them, so I must remember today just to say, can I... I don't know if you can see from there. I got a black... These are my lovely earrings, by the way. I wore them today. That I had off on a few lovely people. Lucky earrings. I got a black tragus piercing and I can't get it out. One of you messaged me and said you can buy a tool off Amazon to get it out, but I'm going to ask today if I can leave that one in, if they'll put tape on it. And if they won't, I'm just going to get Warren to put pliers on it and cut it off. Otherwise, I've got to go to the tattoo shop and pay a £5 just for them to take it out. Warren can cut it off. I've got earring up there. One there. I've got earrings in odd places, so I'll have to take all them out. Smoking. If you smoke, refrain from doing so. I only smoke if I'm on fire. I don't smoke. Nails, please remove all nail varnish and false nails. Ain't got none. So that is that. So this guide wire, I got to go in and they'll inject me with anaesthetic and put this wire in. Is to basically the guide wire is to guide the surgeon as to where my cancer is in my boob. So it's going to be hanging out the side of my tit somewhere. So she said, oh, don't worry, the wire's not left hanging out for you to get caught up on something. I was like, great. They put the wire in and I think they just curl it up. So it's only a thin wire, I think. I hope. And then they put a bandage over it, so you just leave it there. So I won't be able to have a shower tomorrow night. Or tonight, because it is tomorrow now. So I have a shower before we go. I'm not looking forward to that. But that's going to be a bloody breeze compared to what I got when I go over to the hospital then at 2:30. Because when I go over to the hospital at 2:30, they're going to make me radioactive. But apparently it's quite safe for others to be around me. I've got to have a big friggin' needle put down the back of my nipple. Jesus Christ. I can feel it now. They put this substance inside my boob. And basically it travels up my boob and into my lymph nodes. It's actually quite amazing when she said what they do. They put this stuff in. It travels up to your lymph nodes. So when I go in for my operation the next day and they've opened up my armpit, they put this probe in or whatever they put in, and it gives off sound signals, which then tells them which lymph nodes they need to take out. That's bonkers, isn't it? And she said if they don't get enough frequency from my armpit, sound like a robot today, they will then inject me with some blue dye while I'm under. And she said things with the blue dye though is you can have an anaphylactic shock. She said it's quite rare, but you can. But she said if you're going to have one, the safest place to have one is under anaesthetic. So I was like, right, okay. The side effects of having the blue dye, she said you can end up having a blue boob for a couple of weeks. If you cry, which I probably will because I like to cry, she said you can have blue tears. Your wee can be blue or green. You can look very grey for a day or that. And what was the other thing? Oh, there was something else anyway. Imagine having blue tears. Yeah, so that's that. It was just a thought. I've had my nipple pierced in the past. In my younger days when I had everything pierced. And I don't remember that being too bad, but it's just a thought of a needle going down the back of my old nip. Ooh. Ooh. Nasty. It does say, what have they got here about? This is about your lymph nodes. It says invasive breast cancer can spread through the lymph ducts and blood vessels to other areas of the body. And the lymph nodes is the first lymph node. The central lymph node is the first lymph node that the lymph ducts drain into and identifies whether the cancer has started to spread beyond the breast. A new technique called sentinel lymph node biopsy identifies the correct node to be removed, and by taking only the sentinel node, the risk of complications and side effects associated with a traditional axillary lymph node dissection can be reduced. Removal of all lymph nodes from the armpit can cause numbness to the arm area, stiffness to the shoulder, and swelling to the arm. Most of the problems that people have after an operation for breast cancer. She did say I'm going to have limited movement in my arm. Oh, I'll have to get another drink. If none of the lymph nodes contain any cancer, removing all of them is unnecessary. And mine don't contain cancer, or they didn't when she scanned me. But it is not possible to know this without checking on them. Removal of a small number of carefully selected nodes can provide the required information using a much smaller operation. What else is it saying? How do we find the sentinel node? They use two methods. The day before or on the day of surgery, you will visit the X-ray department, and a radiographer will inject a tiny amount of radioactive fluid. Fluid? Oh, so that's why I'm having done. Technetium 99. What? Technetium 99. That there. into the skin of the breast. This can sting for a short time. Oh, so not only are you going to stick a big pissing needle in my nip, it's going to sting like a mother. 2. During surgery, when you're asleep, a small amount of blue dye is injected into the breast. Right. So they're the 2 options, which I might end up having to have both, depending. The radioactive fluid and blue dye travel along the lymph vessels to the sentinel lymph node. During surgery, the surgeon follows the radioactivity with a special probe and the blue colour to find the lymph node. It says the radioactive fluid and the blue dye, which is called patent blue V, are very safe. You sound it. The amount of extra radioactivity that you will receive is about the same as you would get from a mammogram. Patent blue V is used throughout the world of sentinel lymph node biopsies, and we know that it is very safe. However, some problems have been identified.
I don't have an answer for that.
Well, you can piss off. Did you hear that? Alexa piped in then. She doesn't have an answer for that. Well, I didn't bloody ask you. It says, commonly, you may notice a slight blue discoloration of your skin, eyes, and urine after the operation. So I might even have funny coloured eyes. It usually clears in about 2 days. Oh, great. Some patients get a blue mark like a tattoo in the injection site of the skin or on the chest wall, which can be permanent, although usually fades in time. Oh, great. Very rarely, the blue dye can cause an allergic reaction. Oh, so that's what I said about this shock, anaphylactic shock. But it says, however, at the time of the injection is given, you'll be asleep and under close observation by the anaesthetist, which means that any reaction can be detected and treated immediately. I'm glad about that. It says, if the pathology results show that the breast cancer has spread to the sentinel lymph node, then you will need further treatment. This can either be further surgery with complex axillary lymph node removal or possible radiotherapy. If you have any questions, please contact the people listed over Lymph. Oh, and it's just got all the breast nurses and stuff on. Talking of a second operation, she did say to me, 1 in 6 women have to go back in and have another operation. And from my understanding, that is when they do the operation, if they have tested what they take out and they haven't taken enough away, then you've got to go back and have more taken away. Because basically, I said to her, can I just ask you, I said, why don't you just cut the bugger off? I don't need it anymore. I'm not bothered if I've got no tit. And she was like, yeah, but she said, this is much better option. She said, 1, it's a hell of a lot of a bigger operation. You wake up, you've got a drain. Obviously my boobs are big. And she said, you're left with 1 big boob because they wouldn't take both off at the same time. And she said, because of your mobility, because she obviously saw I had a crutch, she said it can cause further problems with your mobility. And obviously if you've got like 1 big boob and nothing on the other side, it'll be lopsided. And she said it can give you a bad back and neck problems and all that. So she said, by having this lump removed and then radiotherapy, it's as good as taking your boob off. So she did say you'll end up with a bit of a disfigured boob because they're going to take out out of a big lump And then she said it might cave in a bit. I was like, oh. I said, I'm not bothered what he looks like, to be honest. It don't bother me. I'm not protective over my boobs. They're just there. They've served their purpose in my life. So if I look like I've been attacked by a shark on one, then don't bother me one bit. So yeah, and then she said, make sure you bring in a nice supportive bra with you. And I went, nice supportive bra? I said, I ain't got such a thing. I've obviously got bras, but I cannot get a bra. Sorry, there's men watching this now, and I'm talking about tits. I cannot get a bra to hold up my mammary glands firmly. They're that bloody big, right? I just haven't got the strength in the straps to hold them up in the air. They're always saggy as fuck, like. I just said, I'll bring... The reason they said to bring a supportive bra in is because when you've had your operation, you're glued together. They use glue. And obviously they don't want your boob swinging in the breeze, pulling on it, and then it ripping open. And I was just like, yeah, bring a bra. But she did say, when you've had your operation and a couple of weeks after, she said, oh, come in and we'll measure you for a bra. That's part of our service. And I was like, I bet you won't bloody get one to fit me. And she was like, oh, yeah, come in. So I might do that. Get measured. But yeah, I got to take a bra. She did say as well, it is a day surgery. But she said, I'll bring an overnight bag in. And I thought, bloody day surgery in my eye. They're going to keep me in. So I just said, oh, should I just get Warren? I said, to bring it in if I've got to stay in. And she went, no, bring it in with you. So I just went, oh, okay. So I got to pack that. What else? I'm trying to think what she said. I can hear voices. It's 2 o'clock in the morning. Yeah, so I'm trying to think what else she said to me. Oh, with regards to chemotherapy, she said when you've had your operation and they've taken out what they're taking out, she said you'll have quite a big scar down the side, and they go in, they take out a massive chunk of good meat, and the cancer is contained inside the good meat, because she said what they don't want to do is cut the cancer, because if they cut the cancer, then it's just going to go and spread everywhere. So they contain it inside some nice, fresh, juicy meat. But yeah, so she said when they test it, when they come out, they've got a certain guideline of how much good meat they take out, basically. And if the guideline comes in too small, you have to go back down and have surgery. I don't know how quickly. It must be, I don't know, within a couple of days, I would have thought. You've got to go back down anyway. So I was just like, oh, that'd be great. But she said they'll do their best to take out the right amount. When it's been tested as well is when they'll decide whether I've got to have chemotherapy or not. If I've got to have it, I've got to have it. I'm not like, oh no, I'm not having that. I'll just do what I'm told. Do as I'm told and I should be all right. So she basically said, if I've got to have chemo, it goes chemo, radio, tablets. Otherwise, it's going to be radio, and then tablets. And she said the tablets will be either for 5 years or 10 years. But they'll decide that once they know what they've taken out. She did also say something about the edges of my boob. If there's any signs of cancer along them, they do something else, but I can't really remember what she said. She gave me these booklets. Oh, I've got to do exercises, man. Oh, I can do exercises. Why do I need to do these exercises after my breast surgery, it says. It can help to regain arm and shoulder movement after surgery and radiotherapy. But I've basically got to do these exercises. So it's really important you do them because it will help your arm movement. It's just that showing you what you've got to do. So I better do them. She also said to me, if I've got something like E45 cream or something like that, I've got to massage my arm. But she said, I've only got to push up, not down. Because she said if I push down, I could end up with sausage fingers. My fingers are quite actually small for a big person. I've got small fingers and small wrists. I'm not meant to be big. There is a thin Karen in here trying to get out desperately, but she's trapped inside. So yeah, I've got small fingers, but she said if you massage it down, you're going to push the water down into your fingers, and she said you don't want that, so you've got to massage this cream in only on my left arm, and you've got to massage it up because she said you're pushing the water back up to your heart. Sounds great, doesn't it? So I've got to do that. What's this one? Oh, this is just a pamphlet on your operation, and this is a support line. It's just information. It says what to take with you. So the hospital may give you a list of essentials. They haven't. Take loose-fitting clothes. Not many of my clothes are loose. They're all tight, man. Loose-fitting clothes, nightwear that's simple to cut on and off. Huh? Oh, it's late in the night. Put on and off, not cut on and off. Allows easy access to the breast or chest and armpit. This will help the nurse check in your dressings after the surgery. Well, I'm not having any dressings. That's bad. She said they don't even put plaster on it. It's literally sewn up from the inside and then glued with like surgical super glue. And she said, don't pick it off. And don't let anyone else pick it off. But then who would be picking off my surgical glue? I do like to pick myself. I'm a picker, you know. But after 2 days, she said you can have a shower and get it wet. But don't pick it. And don't scrub it. But I can't imagine me wanting to scrub it because it'll be painful. And she did say that the bruising from the operation will be quite significant. I had a hell of a bruise from when I had my biopsy done, so I'm going to have one hell of a bruise. Yeah, this book's just basically saying, it says here, bruising. Bruising is common after surgery. Oh, swelling. She did say, if I get too much swelling in my boob and my armpit, then I might have to go in and have it drained off. But then she said you won't need any anaesthetic or anything if they have to do that, because you won't feel anything because they're cutting all my nerves. and I'm going to lose the sensation of feeling anything. So that's great. Well, it says here, change in sensation. Some people experience pins and needles, burning, numbness, or darting sensation in the breast area and down the arm on the operated side. They're quite common and may last for a few weeks or even months. The scar may feel tight and tender. This is because the nerves under the arm have been disturbed to reach the lymph nodes behind them. And a couple of people I know that have had breast surgery has said that the breast surgery was a breeze, but the armpit operation was horrendous. So I'm looking forward to that. Oh, it says here about hematoma. And she did say if I get a hematoma, you might have to go back and have surgery for that. If a very large hematoma develops after a surgery, your surgeon may suggest removing it by drawing the blood off with a needle or syringe. Occasionally, a small operation is needed to remove it. She said something like opening you back up and washing it out. Anyway, I was a bit here about returning to work. I'll be all right with that one. Emotional recovery. I'm not going to have a problem with that. I'm not an emotional person, as in I'm not like, oh my God, I've got cancer and I can't cope. It is what it is. I'm not, what do you call it? I'm not one of these people that's feeling bloody suicidal. It is what it is, I didn't expect to get cancer. I certainly didn't expect the results when I went in. I went in thinking they're telling me that everything's all right. And the lady, one of the nurses, was reading out the letter that Miss Long had put on my file. And it basically said, Karen came in for her results and was somewhat shocked at the results as she wasn't expecting it and was upset at the time. So I didn't tell her any more information and called her back in for a further appointment. So it must be like when they've seen you, they do their typing up. But yeah, I was genuinely shocked when they told me. And I think the reason was that is because people that I know that have got cancer, they were told to bring someone in with them for support when they went in for their results, and they never told me to. So I was thinking, well, I'm all right. They're not going to be saying, oh, yeah, you've got cancer. So as soon as she said to me when I walked in the room and she went, oh, have you got anybody with you? I knew it straight away. So I just turned around to her and said, I've got cancer, haven't I? And she just went, oh, have you got anybody with you for support? And I said, no, but just tell me. I said, I've got cancer, haven't I? And she went, yeah, you have. And I was just like, ah. But it is, like I say, it is what it is. I'm just glad that when I had that big bruise that I went, because I was so close to not going to the doctors, thinking to myself, oh, I'll just see if it goes down. Because when I went to the doctor, he said to me, leave it 2 weeks to see if it goes down. After those 2 weeks, the lump hadn't gone down, but the bruise had totally gone. But now the lump that I went in initially for, which turned out to be fine, is vanished, completely gone, not there one bit. So if I had left it and the bruise had gone and the lump had gone, I would have known that wasn't cancer and I wouldn't have gone to the doctor, and then they wouldn't have found the cancer that was there. Because she said there's no way you would have felt it for a very long time until it was too late. Because it's right on my chest wall at the back of my bust. So they're going to go right into my chest wall muscle. So yeah, so later today I am going to get dressed, and then, do you know what, I might ring the cancer nurse in the morning. Well, I say the morning, it's morning now. I might ring her at like 9-10 o'clock and just say, have I got to not eat for this today? And if she says, oh no, you can eat normally, I'm going to go for breakfast. And if she says, obviously, oh no, you need to not eat, then I won't. But yeah, so that is the story so far. So later today, I'm going to hospital. I will take you along as much as I can, and yeah, let you know. But oh, I thought of that needle. Having the wire fitted, I'm alright because they give you obviously anaesthetic. So I shouldn't feel much of that. But oh, the nip. Oof. Knowing my luck, the needle will be like that, like a knitting needle. But yeah, and then I kept saying it's the thought of being put to sleep that's bugging me. And she's like, you'll be fine, you'll be fine. But they're not going to say, oh yeah, that's terrible, you know. But yeah. So I'm going to go and get a drink because I'm bloody thirsty. Because I've been talking for 41 minutes. Are you still with me or have you given up? So yeah. Thank you. And thank you once again for sending me things off my wish list. You're too kind. And the stuff that is showing on there that's waiting to be dispatched is just madness. And you're all lovely. And your comments are all coming in. And they're so nice. And they're reassuring. And they're just lovely. You're all lovely. You're all lovely. So thank you. And yeah, I'll see you later on. Because by the time you finish watching this, I will I will be home. I would have had all the procedures and I will be home by the time you watch this video. So yeah, thanks for watching. Please give my video a like if you do like it. And don't forget to subscribe and stay with me on this incredibly scary journey. But yeah. So until next time, I'll see you. So thanks for watching. Bye.